I'm going to teach you how to spike your IV tubing, your bag with your tubing for your primary and your secondary, and then calculate a drip rate. So you need to make sure you have your primary fluid and your primary tubing, along with your secondary fluid and your IV piggyback tubing. You'll also need your label for your bags and your label for your tubing. And remember, at most facilities, we change the tubing out every 72 hours. You're also going to need some alcohol to connect the two ports together. So first things you want to do, wash your hands. You need to check your order against your fluid. So I need to make sure my order does say normal saline, and it does. So when you open your bag, you want to be inspecting expiration date. You also want to look and check the color and the clarity of your bag, make sure there's no particles floating in it, and you checked your medication against your MAR or your order. And then you're going to open up your primary tubing, and you want to also inspect your tubing, make sure it's not damaged, no holes are in it or anything like that. Everything about this is sterile. It has an end cap that you're going to leave on. Make sure you leave this on until you're ready to hook it to the patient, because this can hit the table, it can fall on the floor, and you're going to end up contaminating this entire set. So keep your end cap on. And then your spike also has a cap right here, and you want to make sure when you take this off you don't touch the spike and you don't touch the sterile port that you're connecting it to. Okay, the first thing you want to do is clamp your tubing, because you don't want to get fluid all on the floor. So you're going to clamp your roller clamp before you spike your bag. So notice I'm not touching this to anything, and as I remove this cap off my bag, I'm not touching the end of this port. And you want to just spike your bag, push it all the way in. So this is still sterile, and then you're going to squeeze your drip chamber to half full. That way you can see your drops as they come down. Okay, then you can either over the sink in the medication room or over the trash can, you can unclamp your roller clamp, and you're going to fill this whole line with fluid. So you're going to need to watch where it's going. You don't want any air left in your line. And when you get all the bubbles out at the end, you can stop your roller clamp. Okay, so now this entire set is filled with fluid. So then you can put your tubing up on your bowl, and then you're going to label it. So you need to label your tubing for today's date so that you'll know it needs to be changed 3 days from now. And put the time and your initials. Then you're going to put your label right underneath the drip chamber. Okay, that'll keep it from getting wet and dirty. If you put it way down here, the patient might get it wet, so we always put it under the drip chamber. Then you're going to fill out your label for your bag. You're going to fill out the information, make sure that you put your rate of infusion and the patient's name and what the medication is. So this is just normal saline. And then you're going to put this on the back of your bag. I'm putting it on the back because I don't want to cover up what the medicine is on the front. Put that on the back. And now your primary fluid is ready. So now we're going to do our IV piggyback. So this is going to be like your antibiotics, heparin, anything like that that you're going to piggyback into your main line. So same things, check for expiration date, check color and clarity, check your order and make sure you have the right medication that the doctor's ordered. And then you're going to open your piggyback tubing. Check your tubing, make sure it looks good. Clamp your roller clamp before you spike your medicine. It's critical for checkoffs that you don't waste any medication in this bag. It is okay to lose some fluid from your primary bag because it doesn't have medication, it just has electrolytes in it. But if you waste a bunch of your medication, your patient's not going to get that full dose. So that's going to be a failure in checkoffs. So make sure as soon as you open your tubing, clamp the roller clamp. Okay, so in lecture, remember I told you that a gravity system, you have to put your piggyback above your primary line. So that's what this hook is for. So you're going to hook your primary bag onto your pole, and it's going to hang lower than your medication bag. Okay, so you have your primary bag down here, and now I'm going to put my piggyback up here. Okay, because gravity is going to pull this fluid out first because it's hanging higher, which is what you want to go in first. And then after this is done, then you're going to move your primary bag up here, and then this one will take over. Okay, so I have my roller clamp clamped. I haven't removed my end cap. I'm going to spike my medication bag the same way, keeping everything sterile. Shove all the way in. Squeeze your drip chamber halfway full. And then as you fill this up, you want to release your clamp very slowly because remember, I only want to lose maybe a drop or two of medication, if that. So you need to make sure you're watching where it's going. When it gets to the end, you need to stop it. Okay, so now that's done. I'm going to label it before I hook it up. So I'm going to put what the medication is that's added into this bag. So if it's your ampicillin or antibiotic, make sure you put what the drug is and what the doctor ordered the rate at in your initials. And this label goes on the back where there's no writing on the bag. And then you'll also label your piggyback tubing that like you labeled your primary, and it will go here under the drip chamber. Now you're ready to connect the two together. So you're going to take your alcohol swab, and you're going to put it in the closest port available. Okay, so my closest port is going to be here. So I'm going to scrub my hub for 15 seconds. After you've scrubbed for 15 seconds, you're going to take your end cap off of your piggyback tubing and you're going to connect. Okay, so now this line is piggybacked into the main line. You can turn it off.